Hello, welcome to Aspire Education. So this is a small video on UK Plab Pathway. We have been receiving a lot of emails, messages from lots of students, those who want to prepare for Plab or those who want to come to the UK for their future practice. So they're asking like how we can proceed for this, what are the steps. So in this small video, I'll try to explain all the steps including IELTS, PLAB1 and PLAB2 briefly. For any other details, if you want, these are our social media channels, our email info@aspiretoplab.com, our website and our WhatsApp, Facebook group, YouTube and Instagram. So you can find all the details here, and if you have got any doubt, you can use any of these social media channels and you can ask us any question that you have got. So let's begin our UK Plab pathway. So first of all, what you have and what you need for registration. We are discussing only the PLAB route actually. So what you need for GMC registration. So first of all, you need to show your English language proficiency. If you are efficient in your English, so you can do it by doing IELTS or OET. Right, and then we have got our PLAB1 and then PLAB2. So these are the three steps that you have to do. Right, so what we have got is first of all IELTS and OET. So let's discuss and how much bands you need if you have to clear it. So if you are giving IELTS, so you have to have overall 7.5 bands and 7 in each module, 7 in each and 7.5 overall. So that is the requirement for IELTS, right? So 7 in each: listening, reading, writing and speaking. All right, so all these 4 domains you have to clear with 7 each, and overall it should be 7.5. But recently, as you know, they are accepting OET as well, occupational English test. They are also accepting this as well, and which is actually comparatively easier than the IELTS. And now lots of doctors, they are actually following this route, because we have to get a B in all the modules, which is actually comparatively easy. The thing is, it's on the feedback of the candidate, those who have done OET, and they were struggling actually in the IELTS. Right, so if you need more information on IELTS and OET, you can join our Facebook page as well, Facebook group actually, Aspire IELTS and OET. So you'll be getting relevant information if you are on that step of IELTS and OET. So what you need to do actually, so we have to set up a GMC online account. So you can go to the website on the GMC, and you just have to open it, and you have to create an account where you will be putting your IELTS and OET result, right? And then the window will open for PLAB1. Right, so you can make the GMC account anytime, maybe before doing your English exam or after doing that. Right, so once you make that account, you will be putting your details for your IELTS and OET, and then the window will open for booking the PLAB1, and you can book PLAB1 exam. Right, so what is PLAB actually? So PLAB is Professional and Linguistic Assessments Board. It is for doctors qualified abroad to check if they have the right knowledge and skills to practice medicine in the UK. A lot of people, they ask, are we going to get the residency after doing PLAB? See, in simple language, PLAB is a licensing exam. Once you clear PLAB, you can come to the country, come to the UK, and you can do the practice. That is the meaning of PLAB. It's simply an licensing exam. Right, so PLAB, we have got 2 parts, PLAB1 and PLAB2. PLAB1 is MCQ and PLAB2 is OSCE exam, right? And the fees is, they keep on changing, but at the moment it is 235 for PLAB1 and 860 for PLAB2, which is subject to change, and they might change anytime. Where the PLAB1 is happening, to be honest, they are taking PLAB1 4 times in a year. One is March, June, and third one is September and November. So usually all these 4 times, March, June, September, November, the exam is definitely happening in the United Kingdom, and they have got many centers in the United Kingdom as well. They have got centers in London, they have got centers in Manchester, even they have got centers in Scotland as well for PLAB1. Overseas, for March and November, that will definitely be happening in overseas centers, and they have got many overseas centers. Like they have got one in Middle East, they have got many in India, they have got many in Pakistan, many in Nigeria, in Australia, in Canada, and Bangladesh, in Egypt. So they have got many overseas centers all across the world. So March and November will definitely be happening in all the overseas centers. But nowadays, as number of candidates are increasing, so they have actually put June and September as well for overseas centers. They might have few, but these days they are actually having centers for June and September as well for overseas, right? And of course they can change it anytime, but that is the thing in PLAB1. So if you consider PLAB1, so what we have got, number of attempts, 4 attempts we have got in this, and it's a paper-based exam, so you'll be having 180 questions, and the time will be 3 hours. Initially it used to be 200 questions, but now they have reduced it to 180, and because of coronavirus they have decreased actually some more questions, but usually it is 180 questions and 3 hours paper. Passing score, it depends actually, it keeps on changing for sure, but it's roughly 120 plus. So there is no negative marking in this exam, and there is one right answer. So that you will be having 5 options, and you will be choosing one that you think is the right answer, and there won't be any negative marking. So if you are scoring more than 120, so which is actually pass, right? So the passing score might be different. So sometime it is 115, 117, maybe 120, maybe 121. It depends on exam to exam, right? So that is your PLAB1. So in PLAB1, what they are giving us MCQ question, as you know, and these questions are from the acute conditions, important acute conditions, and you will see many questions they will be asking us the management that we are doing in the ward or in the A&E, some ECGs you might see in the exam, X-ray you might see, and some dermatological skin images you might see in the PLAB1 exam, right? So starts with the short scenario followed by a question, and then you need to choose the right answer out of 5 possible answers given. So that is what is PLAB1. So this is a PLAB1 question. So that is how you're gonna get in the exam. For example, a 22-year-old man has had an acute painful right eye with blurring of vision for 1 day. He had a similar episode 1 year ago and has had episodic back pain and stiffness relieved by exercise and diclofenac for 4 years. What is the single most likely cause of his red eye? Right, so that's the question. So they have given us A, chorioretinitis, conjunctivitis, episcleritis, D, iritis, E, keratitis. That's the thing, that kind of questions you are going to get in the exam, right? And this is not a computer-based exam, it's a paper-based. So you'll be having a paper, and whatever answer you feel, for example, the answer here is D, iritis, so you have to put it in your answer sheet, right? So that is how you have to do it. And what about PLAB2? PLAB2, as we know, it is an OSCE exam. So where it is happening, it's happening in United Kingdom only. So at the moment, actually, they have got centers in the United Kingdom only. So there are no overseas centers for PLAB2. So there are many overseas centers for PLAB1, but there are none for PLAB2. It is happening only and only in the United Kingdom, right? So regarding PLAB2, I mean, you can join our group, Facebook group. So you will be getting lots of information, any updates if they are having any. So number of attempts again in PLAB2 also, we have got 4 attempts. As you know, it's an OSCE exam. So we have got 18 station plus 2 rest stations. So what happened, 18 station, meaning you will be getting 18 patients. They are not real patients, they are professional actors actually, but you'll be dealing with 18 different situations. You will be having questions from all the fields, from medicine, from surgery, gynae, pediatrics, counseling, ethics, examination. From everywhere you will be getting the questions here. And each station is of 8 minutes actually. So 18 station, 8 minutes each. And you have got 2 rest station as well. So in total we have got 20 station, 18 station, real stations where you will be interacting with the simulator or the actor, plus 2 rest station where you can have a cup of tea or water. So that's how it goes. Right, and the exam takes around 3 hours. So continuously you have to talk for 3 hours. That is this PLAB2 exam. And for passing, as you know, like we should be fulfilling these 2 criteria. So out of 18 station, we should be passing 11 station. And you know, there will be an average score as well. Like each station is of 12 marks. So each station will be having its passing score. So whatever is the passing score, you have to get above that. right? So then you will be considered as pass. So you have to pass 11 station out of 18, and you have to get more than the average score to pass PLAB2. Centers, at the moment they have got only one center in Manchester. Previously, they had a center actually in London and Cambridge. So they were conducting the exam in these two centers as well, and they did it for around 6 months. They had London, Cambridge, and Manchester. But nowadays they are having and they're doing exam only and only in Manchester. But what we are hoping, they're gonna open more centers. So they might open more centers, maybe in London or Cambridge, or maybe some overseas centers. So we just have to wait for their updates. But at the moment they have got one in Manchester. All right. PLAB2. PLAB2 is an objective structured clinical exam, and courses in the, you can find a lot of courses in the UK, overseas, in certain countries. So what we say in PLAB2, so what you need to do, it is a practice exam. You need to practice with your fellow doctors. Then it becomes easy, because in this you are interacting and you're showing more and more of your communication skills. Medical knowledge they will be checking in PLAB1, and mainly PLAB2 they are gonna check your communication skills. So what we say, like whichever course you are joining, after the course make sure you give enough time to yourself, because many candidates they do ask how much time I should have after doing PLAB2 coaching. We say 6 to 8 weeks, 2 months if you have got after the course, you will feel much better. And in that time we want you to practice. You can practice in the academy, or you can practice maybe online with your friends, right? So that is what about PLAB2. So PLAB2, what you need to do in PLAB2. PLAB2 is mainly improving your interpersonal skills and your clinical skills. They have got questions from every single department, and PLAB2 they are giving more importance to the communication skills, right? So let me show you like what kind of questions you will get in PLAB2. For example, like this: you are foundation year 2 doctor in rheumatology unit. You are told that your patient James Horton, age 45, has been referred by the GP with the pain in the right big toe. Pain in right big toe. So I roughly got the idea what it is actually. You are not given any other information. You must assess and manage the patient. So that kind of questions you will get in the exam. And this is a question actually we have taken from the GMC sample. So General Medical Council, they have given this as a sample question. So we just copy pasted from there. And you will be marked in PLAB2 under these 3 domains. One is data gathering, second is your clinical management, and third is your interpersonal skills. So it will be managed according to these 3 domains. Each domain will be having 4, 4 and 4. So 12 mark for each station, right? So let me show you a sample scenario. The same scenario they will be putting actually in 5 headings. Where you are, so you are a FY2, foundation year 2 doctor in rheumatology, meaning you are an intern. Who the patient is? The patient James Horton, age 45, has been referred by the GP with the pain in right big toe. Other information? None. What you must do? You must assess and manage the patient. Spatial note? None. So that is the way you will be getting the question in the exam, right? And each part of this question has got the importance. Where you are in rheumatology or in medicine, you are in A&E, that is important. Who the patient is, so here you are getting some information about your patient, right? Other information, maybe patient has got some underlying medical condition, maybe patient is taking some medication, so they might be giving some extra information. What you must do, that will be your task. You're supposed to talk to the patient, supposed to talk to the examiner, you're supposed to do any examination or any mannequin, so they will be telling you here. And a special note, maybe patient is worried, we have taken the consent, patient is angry, so that kind of special note you may be having. And what you need to do in this station to pass. So find a history of acute recurrent monoarthritis which responds to NSAIDs. Find a medical history of any medication, psoriasis, trauma. Find out appropriate lifestyle history, because you know this seems to be gout, but you need to rule out some other differential as well of pain in the joints. And plus, you know, if it is gout, there are some risk factors like alcohol, mainly beer. If you are using steaks, that is also very important. Make sure you are able to give the diagnosis of gout, then you are giving the appropriate management for the gout. And what's most important, communication. You identify the patient's concern, you listen to your patient appropriately, and you display display your empathy. I'm really sorry to hear you are in pain. That is pretty important. And conduct the consultation fluently and professionally. And you'll be doing it anyway. Why you will be doing it in a better way? Because you have already done your IELTS and OET. You are good to go for this exam, right? And nowadays, as you know, like more and more candidates are preparing for OET, and OET speaking is actually a bit similar to PLAB2, I would say. So I mean, you will get lots of hints there as well, right? So that is what we have got in PLAB and this PLAB route, right? So simply this route you have to follow for GMC registration, IELTS on OET first of all, then create an account on the GMC, book your PLAB1, prepare for PLAB1, and PLAB1 as you know is MCQ exam, and lots of question banks are available. If you just type the question banks, you'll get lots of question banks available, and you can do it. Maybe if coaching, there are lots of coachings are also there. You can do PLAB1 coaching or the question banks, right? So that is more than helpful, right? And PLAB2 then you have to give, that is an OSCE exam. So PLAB1 MCQ, PLAB2 as an OSCE exam, right? And this is I would say the best pathway and the simplest pathway, and the pathway which most of doctors they follow. Most of IMGs, international medical graduates, they follow this route only, right? The PLAB route. Alright, so that's the small video, and thank you so much. So if you have got any doubts, most welcome to send us the email, or you can ask us on the WhatsApp, Facebook group, Instagram, YouTube. You are more than welcome. Thank you.